Hello, my name is SHARLLENE YAHYU with metric number of BM23110046. This is my presentation for musculoskeletal system. What is musculoskeletal system? It is a system that is made up of bones, muscle, and joints, along with cartilage, tendons, ligaments, and connective tissue. This system functions as the structure of the body, provides support, and allows movements to occur. So for this presentation, I have chosen vertebra. Vertebra is irregular bone with a complex structure composed of bone and hyaline cartilage. Stacking of 33 vertebrae that are arranged at 5 regions make up the vertebral column. It consists of vertebral body, which is the anterior part, and vertebral arc, which forms the lateral and posterior of vertebra. To be more specific, there are 5 parts of the vertebra: spinous processes, lamina that connect transverse and spinous processes, transverse processes that articulate with the ribs in thoracic vertebra, pedicles that connect the vertebral body to the transverse processes, and lastly, superior articular processes that form joints between one vertebra with its superior and inferior counterparts. These are some distinct characteristics of the vertebra based on the structure and region. For cervical vertebra, the vertebral body is smaller and wider from side to side. The vertebral foramen is large and triangular. Its transverse processes ends laterally. And for the spinous processes, it is short, bifid, and long. For thoracic vertebra, the vertebral body is heart-shaped. The vertebral foramen is circular and smaller compared to a cervical and lumbar vertebra. The transverse processes are long and strong and extend posterolaterally. The spinous processes is long, slope posterol-inferiorly. For lumbar vertebra, the vertebral body is massive and kidney-shaped. The vertebral foramen is triangular, and the transverse processes are long and slender. Its spinous processes is short and sturdy, which is thick and broad. In terms of histology, vertebra are made up of cortical bone, which is the dense outer shell of vertebra, and cancellous bone, which is the spongy inner bone. There's also a periosteum layer, which is the outer shell of the bone that supplies blood, nerves, and repairing cells alongside with endosteum layer that lines the center that contains bone marrow. In terms of physiology, vertebra functions for protection as it encloses the spinal cord within the spinal canal. It supports the body by carrying the weight of the body above the pelvis. It also forms the central axis of body and allows movement as well as maintaining posture. Biochemistry elements are applied in ossification of the vertebra. Development of the vertebra begins during the embryonic period as mesenchymal condensations around the notochord. This mesenchymal bone models chondrified and cartilaginous vertebra form. There are 3 ossification centers, which are endochondral centrum that constitute most of the body of the vertebra, and 2 perichondral centers in each half of neural arc. However, 5 secondary ossification centers develop during puberty in the tip of spinous process, 2 tips of the transverse process, and in 2 ring epiphyses. The biochemical elements that took part are firstly, paracrine factor, that induce the nearby mesodermal cells to express 2 transcription factors, PAX1 and sclerexis. These transcription factors activate cartilage-specific genes. Next, N-cadherin is important in initiation of condensation of mesenchyme cells into compact nodules and differentiate into chondrocytes. Thirdly, NCAM is critical for maintaining condensed mesenchyme cells. Next, calcium carbonate is important in mineralization of chondrocytes matrix. Lastly, there's osteoclast for bone remodeling, where it dissolves both inorganic and protein portions of the bone matrix by pumping out hydrogen ions into the surrounding material, which thereby acidifying and solubilizing it. One of the diseases that is related to the vertebra is kyphosis. It is an exaggerated forward rounding of the upper back. It occurs when the vertebrae in the back become more wedge-shaped. This could happen due to fracture, osteoporosis, or disc degeneration. Kyphosis treatment depends on the cause and severity of the condition. It may include medication in terms of pain reliever and osteoporosis medication, or therapy in the form of exercise and bracing. One of the famous practitioners is Dr. Max Green. He is one of the top orthopedic surgeons in Puerto Vallarta, Mexico, listed as #1 in 10 best orthopedic surgeons in the world 2024 article written by Tacit Way. He has had over 20 years of experience in the field and is highly praised for his skills. Dr. Green is a board-certified orthopedic surgeon and a fellow of the American Academy of Orthopedic Surgeons. He received his medical degree from the University of Puerto Rico School of Medicine and completed his residency at the Jackson Memorial Hospital in Miami, Florida. These are my references in preparing this presentation, and this also marks the end of my presentation. Thank you.